Xeroderma pigmentosum, genetic disease that is characterized by such extraordinary sensitivity to sunlight that it results in the development of skin cancer at a very early age. Abbreviated Xeroderma pigmentosum. Children with XP can only play outdoors safely after nightfall. Xeroderma pigmentosum is due to defective repair of damage done to DNA by ultraviolet (UV) light. Whereas normal persons can repair UV-induced damage by inserting new bases into the DNA, Xeroderma pigmentosum patients cannot. A person with Xeroderma pigmentosum develops severe sunburn and eye irritation within minutes of exposure to sunlight. Other features of Xeroderma pigmentosum include very dry skin, xeroderma, blisters on the skin, heavy freckling, and dark spots on the skin. Xeroderma pigmentosum is inherited in an autosomal recessive manner. Defects in multiple genes have been identified that led to XP. Avoiding UV light and using the highest level of sunscreen possible when exposure cannot be avoided helps prevent complications. Xeroderma pigmentosum symptoms. An unusually severe sunburn after a short sun exposure. The sunburn usually occurs during a child's first sun exposure. Irregular dark spots. Thin skin. Excessive dryness. Rough surface growths, solar keratosis, and skin cancers. Eyes that are painfully sensitive to the sun and may easily become irritated, bloodshot, and clouded. Blistering or freckling on minimum sun exposure. Premature aging of skin, lips, eyes, mouth and tongue. Xeroderma pigmentosum treatment. The use of sunscreens in conjunction with other sun avoidance methods, e.g., protective clothing, hats, eyewear, can minimize UV-induced damage in patients with Xeroderma pigmentosum. Sunscreen should be applied to all exposed surfaces, including the hands, the back of the neck, the ears, the lower lips, and the interior part of the chest, whenever UV exposure is expected. The two basic types of sunscreens are physical and chemical. Physical sunscreens scatter and reflect radiation. They contain large particles, such as titanium dioxide, zinc oxide, red fric oxide, talc, and kaolin. Physical sunscreens block UV rays, infrared rays, and visible light. Their main disadvantage is that most are opaque, making them less cosmetically acceptable. New advances in physical sunscreens include microfin particles of titanium dioxide or zinc oxide, which are transparent. Chemical sunscreens absorb UV radiation. Para-aminobenzoic acid, PABA, was the first agent developed, but its potential to cause allergic reactions has limited its use. Some agents, such as benzopenones, mainly block UVA, but they are weak UVB photoprotectors. No matter which sunscreen is used, the degree of protection is only partial. The effectiveness of sunscreens is expressed as a sun protection factor, SPF. The SPF is the ratio of the least amount of UV radiation required to produce a minimum erythema reaction with a sunscreen to the amount of the energy required to produce the same erythema without any sunscreen. Usually, sunscreens with a SPF of 15 or greater are recommended. Xeroderma pigmentosum is a common disease, yet every individual needs unique treatment and care. We encourage people with Xeroderma pigmentosum and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about Xeroderma pigmentosum and how to treat Xeroderma pigmentosum, just click on the link at description or visit www.mainmd.com. Thank you.